Good morning.
What do you mean?
I don't feel well.
Oh, you're just tired.
I've got a headache and I feel sick.
You'll be fine when you've had some breakfast.
I'm not hungry.
Taryn, where does it hurt?
Everywhere.
Oh, stand up.
I can't.
Your timing is the pits. Your dad's away at the minute.
There's always Granny.
No, she's got her Asian lady's lunch.
I can stay here on my own.
Oh, don't be stupid. I'll ring the doctor.
No.
Yes, if you're ill, I want it sorted. There's no point hanging around till you get even worse. Yes, hello. It's Donna Palmer here. I'd like to make an appointment for my son. Headache, off colour. I think he needs to be checked out. You are joking? There must be an emergency appointment system. Well, why not?
I thought you'd be asleep.
Yeah, my phone went.
Oh, go back to sleep, baby.
Oh, I've got a text back.
You only saw your friends a couple of hours ago. So, how did it go? Did everyone say you'd look nice?
Yeah, my dress was nicer than anyone else's.
You looked stunning. I was so proud. Mwah.
Mum, do me a bath.
Hey, good morning, Julia.
You look great.
Oh, thank you.
Good holiday?
Oh, yeah, just what I needed.
All change here, I'm afraid.
Yeah, I know. Greg phoned me while I was away. Did you give him a good send-off?
We didn't get the chance. It's here 1 minute and then we got a text from the airport.
Oh, well, I think he's done the right thing.
What, leaving us in the lurch?
Well, it was a big romantic gesture. I doubt he was thinking about his workload.
Well, he was actually. He nearly didn't go for letting people down.
There you are, you see?
Oh, look. Greg sent us a postcard from Copenhagen. A naked woman on a rock.
It's a little mermaid. We've been splitting his cases, but we had to cancel the non-urgents.
Oh, thanks. I do appreciate that.
Well, it's Nick, Jimmy and George have been putting in the hours.
It's no problem.
So, who's the new partner going to be then?
Sorry I'm late. Welcome back, Julia.
Well, look who's here.
Yeah, he's ill. I don't know what with. He was fine last night.
Oh, dear.
My mother-in-law would normally have him, but she's busy today. I've tried to get him an appointment at my doctor's. They can't fit him in till next week. Useless.
Or maybe they're short-staffed.
Yeah, well, whatever, it's disgusting. I mean, imagine if I was a normal person, I didn't have you lot. Joe, will you see him before morning surgery? You got 5 minutes, please?
Come on.
Thank you. Come on. He says his head hurts and he's got a tummy ache. I mean, if there's nothing actually wrong, I'll just give him paracetamol, see if he perks up a bit. It's just there's so much going round.
OK, Taryn, let's take a look at you. Is there any sickness, vomiting, loss of appetite?
No, nothing till this morning.
Well, his temperature's perfectly normal. OK, can you open your mouth for me? Well, that all looks fine. And you say you have a tummy ache as well?
Yes.
OK, well, jump up on there. Now, lie back, and you just shout if it hurts at all, OK? What about there?
Yes.
All right. There?
Yeah.
Now, which one was worse?
All of them.
Right. Up you go.
Mum, you're supposed to be resting.
Oh, I want to hear about the prom.
Later, I've got someone coming round.
Oh,
Come on, go back to bed.
no, I'm fine.
Come on. Oh, sorry. Sorry, is it still sore?
Mm-hmm.
Well, it's bound to be. And wearing that gross support bra is enough to make anybody feel ill.
Well, at least it means I don't have to look. And then just think, when all the dressings come off, they'll be higher and firmer and no more baggy skin.
Yeah, you will look so much better than any of my mates' mums. They've got these horrible saggy boobs with these stretch marks here and...
Patsy, you shouldn't be looking.
They should not be wearing low-cut tops.
Oh, stop it.
Upstairs, you, come on.
Oh, it should be me looking after you today.
Can't find anything wrong with him.
No bug. Nothing catchy.
No fever, nor sign of any infection at all.
Well, that's a relief.
Do you want to go and wait for your mum in the reception?
Yeah, go and find Julia.
Does he often say that he's ill?
No, he's usually really healthy. He's probably just had too many late nights.
I think it's more deliberate than that.
What?
He was telling me what he thought I wanted to hear.
What, you mean he's faking?
Kids do.
No, not Taran. He knows about my work. He wouldn't make me take time off for no reason.
Maybe he wasn't thinking about you.
All right, I'll ask him.
Donna, don't be too hard on him.
You just told me he was trying it on.
Yes, but if he is, there's probably a good reason.
What, pulling a sickie at 8 years old? If that's what's happening, it's going to stop right now.
You know, he could be saying he's sick because that's all he can think of.
What is that supposed to mean? Come on.
How's he doing?
Yeah, he's fine.
No, I'm not.
Yes, you are. You were a bit poorly this morning, but now you're okay. That happens all the time.
So you're...
I'll get him sorted for school. I'll be back as soon as I can. Come on.
Have Nick or George said anything to you yet?
What about?
About who's going to be the new partner?
I've just walked through the door.
Yeah, but they've had 2 weeks to plan their attack. Or are you thinking of bringing in new bloods again?
I'm not thinking of anything.
Okay, well, fair enough. I mean, it worked with Joe. Only this time, Julia, we need a younger model. It's got to be fit and funny without loving himself and stylish without trying too hard.
Michelle.
It's for the good of a team. You don't want some boring old geezer who keeps bumbling off to the golf course.
You're assuming it's going to be a man.
Oh. Well, a woman would be fine. As long as she's a laugh right and doesn't try and boss me about or mother me or expect me to be interested in a boring and lonely life.
Maybe you should draw up a personal spec.
Really?
No, not really. Listen, I'm not considering anything just yet. There's plenty of time to look at the options and find the right partner.
Hey. You do know you woke me up.
Sorry, I didn't even sleep.
Listen, my mum's in.
It's not right, Patsy. It's getting worse. I didn't know what else to do.
Oh, it's fine. It's for me.
Mariah, isn't it?
Yeah.
Did you enjoy the prom?
It was good. You just stay resting, all right? We'll be in here. It looks fine.
It's really aching.
Well, nobody else has complained.
Well, what shall I do?
Nothing, it's normal. I mean, it's going to be a bit of discomfort.
But when's it going to go?
Soon.
When?
Look, just try not to think about it, all right?
My mum wants me to see a doctor.
What?
She heard me in the night. I was nearly crying.
No, you're not going to any doctor. My mum could get into real trouble and you'll screw things up for everybody.
I know.
Here, look, just take these, all right? They're painkillers, good ones. Take one every couple of hours until it gets back to normal.
And they're safe.
Oh, for pity's sake, Mariah, stop being such a wuss.
Taran! Come on, Dr. Fenton said you're okay.
How does he know?
Well, because he's a doctor. And he sees lots of little boys who think they're ill when they're not.
I am ill.
Please, Taran, I've got to go to work.
Go then.
Look, this isn't fair. It was Julia's first day back. She's covering for me.
Other boys get to stay off. Their mums are nice.
Look, you're going to school. I mean, you like school anyway.
I don't.
Look, is there something you don't understand? I mean, has your teacher told you off? Well, what is it then? Come on, tell me.
Dr. Robinson doesn't work here anymore, I'm afraid. Well, it doesn't matter how long you leave it, he still won't be here. Hello? Hello? Oh.
I know we don't want to rush into anything, but we do need to make some arrangements.
I don't exactly have time today.
We can't keep pushing the patients back.
Well, but just explain the situation.
It's not their problem. If Greg had worked some of his notice...
He didn't think about leaving until it happened, did he? Yes, can I help you?
Mariah Carter? I haven't got an appointment.
Oh, well, I'm sorry, we can't see you today. We're fully booked.
Oh.
Is it urgent?
I don't know, that's why I wanted to see a doctor.
OK, if you'd like to take a seat there, I'll see what I can do.
We need to make some decisions and let the others know where they stand.
OK, I just don't want to cause any ructions. Let me do it my way.
I'm not leaving till you talk to me.
There's this boy.
What boy?
He's in my class. He picks on me.
When? In lessons?
After.
Picks on you how? Does he call you names? What? Did he do this to you? Well, how? What does he do?
Kicks.
Well, just kicks you deliberately in the playground. Where are your friends? Well, what about a teacher then? Why don't you run and get a teacher?
It's after school.
Well, there must be one on duty, Taryn.
There isn't.
Well, there's other grown-ups around. They must see what he's doing.
He does it when they can't see.
And what's your granny doing?
She's waiting. She tells me off if I'm late.
Why didn't you tell me? You should always tell me. How am I expected to know?
I knew you'd be angry.
I'm not angry with you.
You're shouting.
What is his name? Taryn. Just tell me his name.
Darren Harland.
And take a seat. Okay.
It's my arm. It aches.
Okay, have you done anything to it? Any strenuous exercise or lifting weights?
No.
All right, well, if you want to hop up on the couch, you can show me where it hurts.
Okay. It's up here.
Is that tender?
It's not the muscle. Well, I don't think so anyway. It's kind of achy and weak and numb.
Okay, you show me your hand. Pulse is good. You just try and squeeze my hand. Good. Now tell me, can you feel this?
Yeah.
Okay, good. How did you sleep last night? Did you sleep in any unusual positions?
Oh, I couldn't sleep at all. It hurt too much.
So did you take any painkillers?
I didn't think you were supposed to mix them with alcohol.
So you'd had a drink?
Just a couple of vodkas. It was my school prom, so we met at a mate's house before.
And that's all you had?
Yeah.
Well, good.
So can you do anything?
Are you absolutely sure that you haven't wrenched it or just used it in a different way?
Yeah, I'm sure.
All right, well, I think we should leave it a couple of days, see if it wears off. If it gets any worse, or it feels different in any way whatsoever, then come back and we'll reassess it.
Okay.
Okay. Bye.
Bye. Is there a loo?
Oh, yeah, through there.
So?
What?
We have to admit it's good timing. Bracken's not a baby anymore and you're back at work full time.
Sorry.
A partnership going spare. You'll be offered it, won't you? I mean, you are next in line.
Got other plans at the moment.
What?
I'm just saying it's early stages.
George, you're pregnant.
No!
But you're not going for the partnership?
I will discuss that with the partners when and if they ask. I'm just saying I've got things in the pipeline.
I need to see Dr. Woodson again.
OK, when did she ask to see you? Hey! Yes.
I didn't tell you everything before.
Go on.
I had an injection into my armpit
What?
to stop me sweating.
Oh, Botox. So you have a sweating problem?
Yeah.
Axillary hyperhidrosis.
Huh?
That's the medical term for severe underarm sweating.
It wasn't just me. Loads of girls from school had it done.
Why?
Because of our dresses.
So this was for your prom? You had a Botox injection for a party?
Mine was pale pink satin. If I'd have had sweat patches, it would have looked awful.
Well, what's wrong with deodorant or dress shields?
It was strapless.
Well, you're injecting a chemical into your body. This could take weeks, even months to wear off. I mean, who did this? What's the name of the clinic?
Nick,
Yeah?
are you going for it then?
What?
Oh, bless, trying to play it cool. But seriously, you don't want a stranger coming in as partner.
I'm not bothered.
But it's your hard work that goes into this place.
As long as I get paid at the end of the month.
But Nick, I thought like a man of your age, you'd want some kind of security.
Michelle, I'm touched at your interest. And when I want pension advice, I'll let you know.
Hello, I'm George Woodson.
I'm sorry, it's appointments only.
Oh.
Don't worry, I'll get my diary.
No, actually, I just wanted to ask, do you do Botox?
Yes.
Do you not have to be trained?
I'm a registered nurse.
Oh.
I do non-surgical interventions under the supervision of a doctor.
I see.
I use his clinic 1 day a month.
Can you tell me, is there a minimum age?
No, but it's better to start sooner rather than later. If the lines get too set, then the results aren't as noticeable. Well, your forehead's not too bad, but you could do with a crow's feet treatment.
They'll have to lines.
Yeah, but they're still there when you stop smiling. I could do a series of tiny injections that will relax the muscle around the eye. Come in and I'll give you some details.
Come downstairs. You can watch a DVD. I've rung Julia to say I won't be back in.
So I'm not going to school?
No, not today.
Will you watch it with me?
Yeah, of course I will. Come on.
Looks like instruments of torture. I don't think I'd ever have anything like this done.
Sorry?
Do you inject teenage girls with Botox?
No.
So you don't perform any treatments for underarm perspiration?
No, I told you I just do the forehead and round the eyes. I don't touch the underarms except for waxing.
It's just that somebody has given me this as the address.
Who are you again?
I'm a doctor and I'm concerned about what you're doing to your clients.
I run a respectable business. I have references, certificates. I've even got a doctor who'll vouch for my work.
And there's no one else that works from this address?
No.
No one who might use your name?
No.
What?
Well, there's my daughter.
Has she got access to your materials?
You're not seriously suggesting?
Here's just one explanation.
Well, she's at school. She's got better things to do.
So she's never shown any interest in your work?
My treatment room is this way, but Patsy would never set foot in there without my permission.
Mum, I thought you were asleep.
What the hell are you doing?
What's this?
It's collagen.
And what's it for?
It's to cushion the ball of the foot.
What?
No, so you can wear high heels without your feet hurting.
Did she inject the other foot?
Look, it's the latest thing. You know when you really want to take your shoes off, only you can't because then you're going to look like a tramp. And
Did you give her any money?
20.
it's a proper treatment. All the stars are having it done.
Go home.
Mum,
And you get upstairs.
listen, I hadn't even done anything.
Get out of my sight. I don't want you anywhere near me.
Patsy, I'm Dr. Woodson.
Doctor,
Yes, I came here to talk to your mum because I thought she was the one who'd been performing the underarm injection.
Look, if somebody's got a problem, then that's not my fault. I'm really careful. I know what I'm doing.
You shouldn't be injecting Botox or collagen at all. It's against the law. You could face criminal charges.
Hey?
Assault, theft, operating without a licence.
Yeah, my mum's got one.
That's the worst of it, you see. You've used her business, gone behind her back to make money from your friends.
I don't do it for the money. I'm offering them a service they can't get anywhere else.
What?
And I'm good at it. I mean, I've watched my mum ever since I can remember. I started off doing facials and then I did waxing and sugaring. I can do it quicker than she can now.
There's a big difference between beauty treatments and cosmetic interventions.
I help my mum once a month with all the fillers. I get her equipment ready and I watch where the needle goes in. I mean, I practiced on myself before I injected anyone.
Patsy, I don't think you understand.
No, nor do you. Look, I'm not some silly kid. I'm going to be a professional one day. I'm going to have my own clinic and I'm going to do all the best treatments. In fact, my mum can come and work for me.
All day she's been trying to get me out of the way, and I thought it was because she cared.
You really had no idea?
No, of course not. She's always been so responsible. She's so mature. I've always treated her like an adult.
Well, maybe that's why she's so adamant she's done nothing wrong. She says she helps you with your clients.
Helps. For a bit of pocket money. I wouldn't let her do anything on her own.
She's very determined. She wants to make a career of it.
It's just a phase.
I don't think so.
Oh, it's that stupid prom. Her and her friends have been planning it for months. The dress, the limo. It's all just got out of hand. I should have been more involved, but I...
Are you all right?
Yeah, I had a mastoplexy, an uplift last week. It is so sore.
It does look red. Can I feel? It's hot.
I know.
When was the last time you had it checked?
Well, I didn't. They just send you out with dressings and antibiotics.
Okay. Ooh, it's wet.
I know, it's weeping.
Could be an infection. Do you want me to have a look?
Yes, please.
What does Patsy think about all this?
Well, I've had things done before. She thinks it's her friends' mums who are the freaks.
So,
I just want to know who the new partner's going to be.
patience.
Why is it all so cloak and dagger? Honestly, I'd have thought Nick and George would make more of an effort, but that's not, they're not even bothered.
Have you any idea how much a partnership costs?
No, but I know how much you lot earn.
Yeah, well, partners can end up taking home less.
Not in this place.
Okay, maybe not, but you still have to look at it from all sides.
Oh, steady on, don't sound too keen.
It's a big decision.
And one which you're obviously not interested in either.
I didn't say I wasn't interested.
What? You gonna go for it then?
Be stupid not to.
Do you mean that's brilliant? Have you told Julian? What about Nick and George? I mean, George is saying that she's not going to go for it, but that's probably just to lull Nick into a false sense of security. But if she's telling the truth, then you want her as an ally.
Okay, well, calm down and keep it to yourself. I'm going to wait till the others declare.
Clinic's expecting you and I've ordered you a cab.
Will I be out by tomorrow?
Oh, I've no idea. It's not really my area, but I'd guess they'll drain the infection and give you some more antibiotics.
Thank you.
You're welcome. What are you going to do about Patsy?
She's going to her dad's tonight.
In the long term?
I'll lock my equipment away for one thing. But that's not what you mean, is it?
I just think she treats you as a role model and you probably need to be aware of that.
Some role model. It was different when I started. Facials, manicures. Now the pressure on women is unbelievable.
But by conforming to it, you're just making it worse.
Yeah, I know. You're right. I'm not going to do this anymore. I didn't even want to be a beautician. I loved nursing, but the shifts were impossible with a baby. I just wanted to work from home and look after Patsy. But that was the worst thing for her, wasn't it?
Yeah, but you can do something about that.
How?
Well, by being honest with her, telling her what you've just told me. That'll be the taxi. I'll tell them to give you a minute.
What's going on? I've got to go back to the clinic. My breasts are infected.
You'll be all right, though. Here, take your makeup.
Did you hear what I said?
Yeah, but you're going to want to look nice.
What have I done to you?
Oh, Mum.
You're going to stay with your dad for a couple of days. He's coming to get you.
I'm not going with him. You can't treat me like a kid.
You are a kid. We both must remember that.
I've been thinking. This is what we're going to do. First, I'm going to explain to your teacher what's been going on. Then I'm going to fix it with Julia that I can pick you up from school, okay? I'm going to pick you up, take you to Granny's, and then we're going to talk. Proper talking, so I know you're okay. And you will be. Trust me. Okay? This Darren boy, he's probably picking on lots of children. It doesn't say anything about you. It's all going to change. You don't have to deal with this anymore on your own, because that's what I'm here for, to help you. But you've got to promise me one thing, that you'll tell me everything from now on. Tara.
Tonight, Jim and Dot come clean about baby Thomas. EastEnders at 8 on BBC1. And back to this afternoon, and childhood memories come flooding back to haunt Dr. Sloan in Diagnosis Murder next. The one-to-one